Hey everyone, welcome back to another flipped lesson. In this lesson, we're going to be going over the first part of musculoskeletal injuries. So, an introduction to a brief overview of anatomy of your muscular system, your skeletal system, how they work together, and then some of the basic injuries we're going to see. So, we're definitely going to go more in depth on future lessons and in class, and then we'll talk about how to treat these afterwards. Little bit of a gore warning here in this video. So just be prepared when we get to some examples of the actual injuries. Nothing too bad, but we will see some broken bone and maybe some blood. So make sure you know these at the end, and we'll move forward. All right. So a quick overview of anatomy and phys. And again, we could spend all year talking about the anatomy of the musculoskeletal system, right? But really, for us, what we need to know in emergency medicine, it boils down to three parts, right? Your bones make up the skeleton. Your muscles are the power and the movement, and the joints are how those two interact to make something move, right? So we have all these muscles all over our body, which we can injure, right? And we'll talk about what muscle injuries are. And then we have all these bones, which we can injure. And then, of course, you can also injure a joint, like an elbow or a shoulder, or, well, I mean, any joint, really. So these are like the three parts that we need to think about every time we have a patient that has an injury to their muscle or skeletal system, right? We need to think about which of these is involved. So let's break down the skeleton while we're talking about anatomy, right? There's two parts to the skeleton that we break it up into. We have the axial and the appendicular skeleton. So the axial refers to the skull, the vertebrae, and the thoracic cage. And this is what takes away from your upper to lower body. It's what helps us sit upright. Versus your appendicular skeleton is all the bones attached to your shoulder, your arms, your pelvis, and legs, which are responsible for movement. Great way to remember is I always think about axial skeleton like the y-axis on a graph. The y-axis goes up and down, so the bones that help you stay up and down. And then the appendicular, right? We hear that word appendage as the root word. So your appendages, right, are your arms and legs. So all those bones associated with that. And we can see here the appendicular skeleton, all the bones started from our clavicle, scapula, down to our arm, from our pelvis down to our metatarsals, phalanges, both of them. And then your axial, right? Skull, vertebrae, sternum, and your ribs. Couple of three major categories of bones, right? And again, how we break these or injuries might differ how we treat each one. So we have our long bones, right? Our humerus, radius ulna, femur, tibia, fibula. Okay, these have a growth plate or the epiphyseal line, which if you break that as a kid, maybe you have heard someone who broke their growth plate, that can be kind of dangerous because it could stunt growth. It could kind of deform the limb, so it's a serious injury we need to think about. Then you have your flat bones, right? Your skull, scapula, ribs, sternum, pelvis, ones that they're not necessarily small, like really big, but they are flat. And then you have your irregular or your funky bones, as I like to call them, your vertebrae, the hands in your wrist, right? Your carpals, metacarpals, hands, tarsals, metatarsals, your feet, and your kneecap, your patella. So those are our three categories of bones. And again, we could see some of the different ones here. So your ribs, your humerus would be a long bone. Your vertebrae here, each one would be an irregular bone. Your scapula would be a flat bone. Some of the different ones. So what is a joint, right? A joint is where two bones connect, essentially, and the connective tissues that surround and support them are called the joint capsule. All right, and you have this special type of fluid called synovial fluid. Sorry, I should have made that bold there. That are in the joint capsule that lubricates the joints, right? It's just like how a door attaches to a wall, right? At a hinge, which that's a type of joint here. Right, your door, if it's squeaky, you need a little WD-40 to help lubricate it or some grease. So that synovial fluid is like a grease or a WD-40. It lubricates that joint. And all those joints have that, right? So we can have issues with the synovial fluid. We can also have issues where the joints actually attach. And I'm not going to make you memorize all these different types of joints here. But this is your humerus with your radius and ulna that forms a hinge joint, just like a door, right? One that closes. Your vertebrae have these plane joints, flat, so you can kind of twist like that, right? Your wrist has a saddle joint. Look at all the directions in there that you can do with your wrist. Okay, so there's many different joints. Classic here, your humerus up into your shoulder girdle is a ball and socket joint, right? Lots of free motion. So those are the different types of joints, some of them. All right, so how do we connect all these things? Well, two big words here, ligaments and tendons. And I'm sure you've heard of these before. So a ligament connects bone to bone. All right, so ligaments are bone to bone. They're part of that joint capsule. And tendons connect muscle to bone. All right, and you can injure both of these very easily. I'm sure you know somebody who has. So if looking at this picture of the knee here, right, you can see the ligaments, right, are connecting bone to bone. So this is your femur, this is your fibula, all right, this is your patella, okay, and you can see the ligaments attach here. So that would be like your MCL, your ACL runs up through this way, your LCL on the other side, and then you have your tendon, which connects like your quadriceps muscle here, right to your patella, which goes down to your fibula, right. So tendons are muscle to bone, ligaments bone to bone. And if you, especially we see a lot of ligaments in knee injuries sometimes, or ligament injuries in knees, like ACL tear is a classic one. And that can actually provide a good test for that is if someone has a lot of instability, right? If you tear one of these ligaments here, well, now your bones aren't really connected. So they can kind of, if this is your femur and this is your tibia, right? You can actually have a lot of instability and they can slide apart, which is not good. Tendons, we'll talk about how you can injure those too. But if you injure a tendon, right, that muscle is no longer connected to bone. And we know the way we move is that our muscles contract and pull our bones closer together, right? So if you tear that tendon or injure it, you can no longer move that whole appendage, which is not good. And again, just some, you can see some directions here. You can see, here's your ACL again, which is a common one. PCL, here's your tibia, right? So these are all ligaments that connect your bones of your knee. And then just a brief touch on muscles. I mean, I'm not going to go too crazy on this, but just if you remember from biology and from anatomy, if you took it, right, 3 types of muscle tissue: skeletal, cardiac, and smooth. Found in your blood vessels, your digestive system, cardiac, and your heart, obviously. And then skeletal is responsible for those movement, right? They have many differences, but they could still be injured all the same. And usually with musculoskeletal injuries, we're going to be talking about that skeletal muscle. And it, just like connective tissue, right, it can be repaired, so that's good. But sometimes, in the hospital, depending on the severity of the injury, we might have to have surgery or other things to help us heal those and get back to normal. So talking about healing, right? Let's talk about the healing process. So connective tissue, which is like your bones, one of your tissue that can regenerate and can heal. And I mean, we could spend weeks talking about how bones heal and getting into that. But essentially, all we need to know for emergency medicine is that your bones are going to heal. It just takes time, right? And part of it's all about that connective tissue. So your blood is a part of that. Bleeding is a natural part. And we need to make sure that everything's lined up and in the right position. So when we look at some of these other types of injuries where maybe it's angulated or displaced, we need to think about putting them in the right way. Now, EMS in the field, we're not going to worry about that, but something to think further down the line in emergency care. And again, maybe if you've broken a bone, like I broke my wrist before, you set it in a cast so it's in the right position and it heals on its own, right? You might need more extensive help in healing. And then you can see this guy's got a rod down his tibia here. And he's got some pins here, some screws. So you can get a lot of hardware depending on how you break something. Cool. So let's talk about some of these types of injuries. Okay. So a sprain is a stretching or tearing of a ligament. Okay. And if you tear it, you might need surgery. So we often think of like, oh, it's just an ankle sprain, right? There's actually a wide array of sprains, right? You can have a very mild sprain where it's sore for a day, the next day it feels better, all the way up to like complete tear, right? I tore my ACL. That's actually a really just terrible sprain, the worst degree you can have. And this happens when a joint is displaced beyond its normal alignment. And I'm sure everybody's just stepped funny once and rolled their ankle, right? So you can see in this picture here, right? These are some of your ligaments that are connecting your tibia and your fibula down to your ankle bones, and there's little tears in those ligaments, right? That's what looks like healthy. That's not healthy. Okay, so that's not good. Your body might be able to heal it if it's a little tear, but if it's big enough, you're going to need surgery. Okay, so ankles are a big thing we sprain, but again, we could sprain any joint, right? Remember, ligaments connect bone to bone, and what do we call a place where two bones meet? Joint. So you could sprain your shoulder, you could sprain your wrist, you could sprain your knee, your ankle. any of those can be sprained. All right, so that is a ligament injury. Versus a strain, all right, is a stretched or torn muscle, usually from poor body mechanics. That's why at the beginning of this class we talked about lifting, really important. And again, just like a sprain, it could be from minor all the way up to severe. All right, and I like this picture down here, your gastrocnemius, your calf. All right, we see that's what it looks like normally, but you can have different levels of a calf strain. Little grade 1, that tiny little blip right there. Grade 2, a little bit worse. Grade 3, that's a major tear, right? You're going to be not uncomfortable for quite a few weeks there. And again, if it's bad enough, you might have to get surgery or something to help repair a strain. So very often these two are confused, right? You strain a muscle or a tendon and you sprain a ligament. So just keep that in mind. Okay, now getting into some of the other more fun injuries we might see. So again, those tendons connect muscle to bone. So that's like your Achilles tendon down here, connects your gastroc to your ankle. All right. And so a tendon rupture is when, literally think about it, rupture. And we'll see this picture here. It's a little gross in a second, but we totally tear or pull apart that tendon. Not good. Because again, if you pull that tendon, right, a lot of times we see this in people's bicep too. They rip the tendon off the bone and the muscle actually, instead of your bicep going your whole arm, actually shrinks up to your shoulder. Kind of gross. So you may not be able to move that joint. All right, probably the more common injuries we see are the fractures, right? And also known as a broken bone. Okay, so there's a couple of different levels or types of fractures here. The key thing to remember with fractures, and especially in the ski patrol world, we see lots and lots of fractures. It's the fun stuff. It's what we all want to do. Not fun for the patient, fun for us, usually. But it's important to remember, right, especially in our next lesson as we start to think about treating these, every fracture is going to be different. Every patient's going to present different. And you might have, every fracture is going to, I think I said present different. So it might be in a different shape, right? We need to think that when we're treating these and splinting these, we need to be creative for every different fracture we have because they're not all going to be the same. So a fracture is a break in a bone. Well, two kind of major categories. We have open. We used to use more compound, right? But an open fracture versus a closed fracture. So think about open. It breaks through the skin. We've now opened the body. So that's that classic fracture where you break something and now the bone is sticking out, okay? And we just did our Stop the Bleed course. So you got to remember, we kind of have two injuries here. Not only do we have a musculoskeletal injury, but if your bone is sticking out, we now have a bleeding emergency too. So you need to think about not only splinting the injury, but you need to think about controlling bleeding. Especially if you might nick an artery or a vein, you have a lot of blood loss there. So thinking about our pressure bandage, direct pressure, putting a tourniquet if we have to. Okay, so an open fracture is when the bone's sticking out. A closed fracture is when it's contained in the body. So you break your wrist, the bones are broken, but nothing's popping out. Okay, nothing opens up. Still can be very serious. Still can get some wonky looking injuries, as we'll see in a second. And we'll look at more gross pictures in class, I think. I don't know what YouTube will let me put up here, but that's a closed fracture, right? But we need to remember, just because it's a closed fracture doesn't mean that you're not bleeding. We still might have a bleeding emergency, but it might be all internal. And unfortunately, there's not much we can do in EMS about that. Rapid transport, all right? Another type or characteristic of a fracture is that it may be displaced, right? Which is when it's out of alignment. So normally, right, our wrist looks like that, our arm looks like that. But if you get some funky shapes, right, that's a displaced, sometimes called angulated, depending on if it's twisted at an angle, okay? And like we just said, it may be associated with internal, external bleeding. Well, I'll tell you what, there's always going to be bleeding with a broken bone because that's how the bone actually heals itself, is it starts bleeding and then that blood clots. Whether or not it's life-threatening, who knows? We need to always just have that in the back of our mind, though, when treating trauma injuries like this. All right, so gore warning, right? Tendon rupture. This is your gastroc. This is your Achilles tendon. If it totally ruptures like that, and I had a friend actually who this happened to, tore his Achilles tendon, you have to get surgery. They might put something in there to hold it together. They stitch it back up. You're good as new. Well, maybe. Okay, an open fracture. Again, the bone comes out through the body here. So you could see this was an open fracture. I believe that's the same x-ray of this guy where his tibia actually came out through the skin there. So again, pretty scary stuff to see. You want to control that bleeding, splint it as best we can. Make sure you put some gauze around it, and hopefully if the bleeding's not life-threatening, they'll be able to take care of this. You can see this guy's got some nice hardware here. It's pinned up until it starts to heal. And yeah, so open fracture comes through. I mean, there's so many gajillions of pictures we could put, but I'm trying to keep it PG here. So then a closed fracture, right? These are your classic, oh, I broke my wrist, I broke my radius, oh no, humerus, okay? And again, you can see these x-rays, right? They're not, so the cloudy white stuff is the skin, right? So it's not coming through. You can see these bones are clearly broken, right? That's a tibia, that's a humerus, it's also a humerus, not very funny. All right, but you can see they're broken, but they're not breaking through the skin, okay? And I believe, I believe we would actually, at this point, I would, sometimes we talk about the different types of fractures. There's actually like 10 different types of fractures, transverse, green stick, all these different ones, but I'm not going to teach us all those. Just know that if it's broken, it can break in many ways. We like a nice, I'll say this though, we like a nice clean fracture like that, but bones don't always break like that. Sometimes they break in a lot of little pieces, depending on the mechanism of injury. We know that word. Sometimes they might like splinter. Those ones are not really easy to heal. So sometimes they might spiral around the whole thing. We like a nice, clean, transverse fracture. We don't like all the messy stuff. That's a long healing process. So those displaced fractures, right, or angulated, we call them. I think we'll see angulated on the next one, right? This picture right here kind of sums it up. So you can see how these are twisted, right? They are not normal. So displaced means like if you break the end of your humerus and it totally moves over. And again, we're going to see that when we do our assessment and we look and we palpate, we'll actually see like, oh, dang, this guy's arm is totally away. Angulated, right, means the bone's off at an angle, and then rotated, okay? These two are never fun to deal with, the angulated, rotated, because A, the patient's in a lot of pain, and B, we got to try and figure out how we're going to stabilize that in a wonky position. So I think a couple of gross pictures here, maybe not too bad. Oh man, this is my favorite fracture. I've treated a whole bunch of these over my career, and I think I've talked about them in class. This is called a fork tongue fracture, right? It looks just like a fork where it goes straight. The tongue comes up to the actual fork, so you can see them here, right? This would be a type of angulated fracture because it's off at an angle. So, okay, how do you splint that? Sam splints, way to go. Here's another one, right? We see this, could be also, it looks like a tibia fracture, could maybe be a dislocation too, who knows? We'll talk about those in a second. So yeah, angulated, displaced, basically funky positions, not fun for the patient, all right? And again, just thinking about that bleeding, right? We're gonna have bleeding, obviously with broken bones, we said, but how much is it, right? If it pops out, if it's an open fracture through the body, is it gonna be a significant amount? Think about your mechanism of injury and what caused the trauma and how much bleeding that might do. And you got to remember, right, just because if there was enough force to break a femur or a pelvis or a tibia, could that force have injured other things? So could it have injured the brain? Could it have injured internal organs, your lungs, your liver, your spleen, that also are very vascularized and can bleed a lot? So just thinking about that. All right, and then dislocations. Oh, these are fun too in the pretzels and jams department. The separation or displacement of bones at a joint, and they usually result from a forceful trauma. So this is not when we break something, but we basically pull a joint apart somehow. And they can be really, really dangerous for the patient or complicated because there's a lot of structures that run through our joints, right? Think about all the things that run through our body, our blood vessels, arteries, veins, nerves, right? Lymphatic system. If you take a joint and pop it a certain way, those bones, instead of being where they normally are, they might now be pushing on a nerve or a blood vessel. And that's not good because we need those to make sure all the tissue in our arm, let's say, or leg or wherever, stays alive, okay? So we really need to think about the complications of this. So classic shoulder dislocation, right? We could see the humerus pops out of the glenoid joint here of the shoulder girdle. This is a fun one, okay? That's your patella, your kneecap. It's actually pretty easy to dislocate. However, very easy to reduce too, usually. Just pop it back in. All right, and this is a tibial dislocation here. We can see this is the guy's femur. and his kneecap, I believe, that come down to here, and then his tibia's over here. So you can dislocate any joint, and not fun. Okay, usually a lot of pain. All right, and then just one more time, thinking about blood loss, because again, broken bones, yeah, they suck, but we can get them fixed. But what's going to kill you, right? We talked about it in our last section of Stop the Bleed, right? Most traumas are from, or most death from trauma is from bleeding, okay? Majority of it, vast majority. It's the biggest emergency besides someone being in cardiac arrest. So thinking about it, and again, for most of these injuries we looked at, they're closed injuries, right? They're not open to the skin. So we may not even think about bleeding, but we need to always think with a trauma patient, there's internal bleeding, okay? And this is, we'll talk about the picture in a second, but depending on where you break, your tibia fibula, that number is covered up. It's similar to the humerus, right? But your femur, you can hold 500 to 1,000 milliliters of blood. Your pelvis can hold up to 1,500 milliliters of blood. That's like a third of your entire blood loss. So you could be really going into decompensated shock. We'll talk about shock a little bit more in class, right? But your body could be going really downhill from bleeding, and we don't even know because we can't see it. It's all internal. I mean, look at this, is just a cool picture. It shows the vascularization, right, running really through the pelvic girdle, especially. You have your descending aorta, vena cava, and all the other blood vessels come off of it. If you fracture this pelvis and nick or cut or damage one of those blood vessels, you could just pump dry, right, and bleed out internally, and there's nothing. A, we wouldn't really know, and B, we could not treat it in the field. So you need surgery, and that's why rapid transport, good assessment, monitoring our vital signs are key for this. All right. So that's the end of this video. Up next, how do we treat all these? And that's the fun part. We'll get to play with these. So make sure you know everything in this video. Go back if you had any questions, if you missed anything. And hey, see you on the next one. Stay tuned.